Hi, everyone. I'm Jennifer Spitolnik. I'm one of the COVID health educators with the Public Health and Human Services Department in Columbia and Boone County. And today we're going to be talking with Dr. Ashley Millam about the new COVID-19 vaccines. So there's a lot that we're still learning about those vaccines, and we're going to sit down and talk to her. She's our medical director about what we know as of this morning, December 17th. So we'll also be doing our best in the future to keep answering your questions as we know more and as they arise. So hi, Dr. Millam. Thank you so much for joining us.
Hi, thanks for having me.
Yeah. All right. So let's go ahead and get started. One of the biggest questions that people have is when will I be able to get vaccinated?
Yeah, that is the question right now, and so it depends on a couple of factors. Um, this is kind of getting rolled out in what we call a tiered phase. So even within phase one, so the first folks who get the vaccine, there's a 1A and a 1B. And there's a couple of reasons for that. And so, if you are someone who works in healthcare who has potential exposure to patients or to infectious materials, you would be in phase 1A, so the first group that qualifies to get this vaccine that's been approved. And also if you reside or work in a long-term care facility. And so those are the two groups that are in that kind of 1A category. And then 1B, so we'll talk about those first two groups, and then we'll talk about kind of where you can find the other groups. And so 1B, so once 1A folks in Missouri have been vaccinated, then they will move on to anyone who desires vaccination in that phase 1B group, which is folks who have risk factors, and that's folks between the ages of 18 and 64, and then individuals over the age of 65. First responders will also be in phase 1B, as well as essential workers, which includes folks who work with the public rather than patients in the healthcare field, teachers, educational staff, folks who work, so we think of our critical infrastructure works in this particular category, folks who work in food and agriculture. And then there is a great website actually for this particular question called covidvaccine.mo.gov. And if you go to that website, you can see the really nice colorful chart that talks about all the different phases, so past 1B. And you can see kind of where you would kind of fit into that. And this is certainly optional, just to kind of clarify. So it's not that it's mandated for all folks in those phases, but that is who will qualify for it. And I thought this might be a good time also to kind of segue into why that is the 1A group, because I think that's kind of been a question for a lot of folks. And the reason that healthcare personnel are in the 1A group is specifically to protect healthcare capacity, which we know is an issue during a surge in the midst of a pandemic like this, but then also to prevent patients from contracting COVID-19. And so that was really, those were the two major reasons that that categorization occurred.
Okay, thank you. So one thing that a lot of people are asking is, so I know that I'm in this group, I know that I am in the 1A, 1B, whatever, but how will I know that it's available for me? Like, how will I know that it's my turn now?
Absolutely. So lots of information is going out. So right now the information is going out to 1A folks, but there's tons of communications happening for our 1B folks too, whenever we look at those phases. And so there is going to be there's big pushes to get the information out to those particular groups, and especially whenever it's available to the public. So as we move into that 1B, where it's not just about your job or where you live, but it's also about your personal health risk factors and your age. We anticipate seeing it be available at pharmacies and as well as our health department, as well as our hospitals. And so all those folks are involved in the planning for this, and figuring out how are they storing this, how are they going to administer it in the safest way and most efficient way, because we want to make sure as many folks who desire to get the vaccination can get it, and as quickly as possible, because obviously this pandemic is really affecting everyone. And so the people who want to get it, most people want to get it as soon as possible. And so we want to make that happen. I'm taking a very broad we with that. So there'll be lots of information coming out. I think there'll probably be lots of signs about you can get your COVID-19 vaccine here. And so just keeping your eyes open, and then also checking back to that covidvaccine.mo.gov, and checking our, we'll be promoting it here, kind of where you can find it in Boone County as well.
Yeah, I know that that's definitely going to be a big part of what we're doing over in health promotions is making sure people know where they can get it, how they can get it. And of course, the federal government, the state, local, the tribal, territorial governments are all very invested in people being able to access it very easily. So there's a lot of partners with that to make sure, local pharmacies, et cetera, like that you can get it easily. Um, and so this was a question that came up on our Facebook page, and I didn't think about this, and I don't know if you know the answer, but will people be given any record or proof of vaccination?
Yeah, that's a really great question. So it'll a little bit depend on where you get it from, but I am certain that everywhere you get it, we'll be happy to give you documentation of that. It'll also probably get loaded into the Show Me Vac system, which is the state registry, if you'd like it tracked that way. And so because it's going to be available at so many different places, I don't know the exact process at each of those places, but I am certain that you will be able to have documentation of that.
Okay. I do know that it has to be, it's required that it be tracked. So I know that at least it'll be tracked even if you don't have that immediate certificate in your hand. So here's a big question that a lot of people are asking in a big range of ways, but are there any side effects?
Yeah, that's a really, really great question. So there definitely are some mild side effects that can happen. And that's just about with everything, including over-the-counter vitamins and supplements. And so not trying to minimize that risk, but everything in health and in medicine is about weighing risk versus benefits. And that includes whenever it comes to vaccines. So from the over 36,000 folks that were in that, the Pfizer and the BioNTech study, so that was phase 3 of their study, had over 36,000 individuals. And so the primary side effects that they saw, just not the majority of patients, but of the folks who got side effects, it was injection site pain, fatigue, joint pain, muscle aches, headaches. You can get a fever, you can get GI upset, like vomiting, and they did not have any serious reactions in that. There have been some reports, I believe, since it's come out in the UK, of a couple of allergic reactions. This appears to be incredibly rare. So the side effects we see are mild, and still bothersome, but mild, but not the majority of folks getting it. And these are all side effects of us boosting the immune system. And so just like with the other vaccines we get, if you get a sore arm after your flu vaccine, you kind of think it's doing its job, right? The whole point is that it revs up my immune system, and helps create these barriers to protect me from the virus whenever I actually get exposed to it. So whenever you look at risk versus benefit, there is risk of mild side effects with the vaccine. There is very real risk of getting seriously ill with the virus. And so I can tell you, even if I get every single potential side effect that was shown in phase 3 of this particular vaccine, I will be very grateful to still have gotten the vaccine, because the risks just do not even compare to getting the infection.
Thank you. Yeah, I know that it's a thing that scares a lot of people, but we also know that really with any vaccine, there's going to be some side effects, like you said, because that's how it works and it shows that it's working. I just want to circle back around just a little bit to that severe allergic reaction, because there are a lot of questions about that, especially because I know that it happened like just a couple of times in the UK, and now it's happened once in Alaska. And part of the requirements for vaccinators, people administering the vaccine, is that they be able to observe the person who gets the vaccine for at least 15 minutes afterwards, that they be under observation, and 30 minutes if they have a history of allergic reactions. And so in all cases, the severe allergic reaction was caught during that observation period. But can you just talk about if there's any way to predict who's going to have that reaction? And if they should still get the vaccine if they know they're going to have the reaction?
Sure. So there would not be a way for you to know prior to getting the vaccine if you, as far as I am aware at this time, I feel like I should probably preface everything with that, because like everything with this new virus, we learn new things all the time. And so that's why we're all keeping our eyes and ears open to new information, and paying attention to that. But based on the few cases that have happened so far of allergic reactions, we don't have a way to know. And whenever you think of 3 in many thousands, that's really hard to draw a pattern from. And maybe someone much smarter than myself can draw that pattern, and we can follow it. And so we will definitely keep a lookout for new information and new guidance with that. But unless you have a reaction to the first dose, if you have a serious allergic reaction to the first dose, then you wouldn't get the second dose necessarily, unless more guidance comes out on how you would prevent it for the second one. But that's really the only indication to not get the second dose or to not get the vaccine. So before getting your first dose, you would not know if you were going to have an allergic reaction. That's exceedingly rare for that to happen. And we know that the folks administering it have all the things they need right there on hand if someone has a reaction to be able to treat them.
Okay, thanks. There's also some discussion, the flu vaccine is often egg-based, but this one is not egg-based, right? So it's not a concern for people who are allergic to eggs.
That's I see what you're saying. Yeah, that's a great question. So if you have allergies to other things, this is not, there's not any crossover that I've seen or that I believe that they're aware of that would make you more at risk of having an allergic reaction. So I've not seen anything about if you have a history of this type of allergy that would increase your risk. I don't think we have any of that information. I don't know if it exists, but there may not be any other kind of crossover with an allergen. If there is, I don't think we can see that yet, probably just based on how rare the allergic reaction itself is.
Okay, great. Thank you. So speaking of, you shouldn't get the second dose if you have a severe allergic reaction, which is very, very rare and unlikely to happen to you. But so that's one case where you should not, right? But other than that, do you need the second dose?
Yes, so that is literally the only reason to not get your second dose is if you are one of those, I guess, 3 in, I don't know how many thousand doses have been given now. And so this kind of depends on which vaccine we're talking about. I feel like maybe backing up just a little bit to give folks a little bit of a background who haven't seen this information already. So we're really talking about, predominantly right now, we're talking about that Pfizer and BioNTech vaccine because it's the only one who's received that FDA's EUA, which is the emergency use authorization. We expect Moderna to likely get that soon. And so those are the 2 vaccines that we're really focused on right now. There's another couple that are kind of just delaying their process a little bit to kind of adjust and make them as safe and effective as possible. So just to be clear, kind of what we're talking about, we're really kind of focusing on that Pfizer one because it's the one that's here being given right now in mid-Missouri, but we anticipate the Moderna to be very soon. And so both the Pfizer and BioNTech vaccine, as well as the Moderna vaccine, are 2 doses. You really need 2 doses to get that immunity that they saw in the studies. And so it's 21 days apart for the Pfizer and BioNTech vaccine. It's 28 days apart for the Moderna vaccine. And it's really, really important to get that second dose because that's whenever they confirmed immunity. So that's what was studied. That's how you get your 95% efficacy for one of them, 94% efficacy for the other, which is really impressive. That's really efficacious. Which is awesome. And so, but it's 2 doses. And again, the side effects appear to be very mild, very minimal. Risk of vaccine compared to risk of infection, right? That's the whole thing here. That's what you want to be weighing in your mind is risk of vaccine versus risk of infection.
Absolutely. Thank you. Okay. So after someone's gotten the vaccine, is there like a wait period before they have sort of immunity?
Yeah. So so what we're going off of now is the phase 3 studies. That's whenever they studied thousands and thousands of people. And so for Pfizer, they confirmed immunity 7 days after the second dose. And for the Moderna vaccine, they confirmed immunity 14 days after the second dose.
Is there any measure of immunity after the first one?
That's a great question. And for these 2, so for the Pfizer and the Moderna one, I have not seen those numbers. And so I don't know if that is just hasn't been published, or maybe I haven't seen it. Or if it wasn't necessarily studied, if they knew it would be 2. I do think that's a lot of folks have maybe seen that was one of the reasons that AstraZeneca delayed theirs, is that whenever they tested efficacy with a single dose versus a 2 dose, it was 62 compared to 90%.
Mm.
And so it does appear that, so it appears to me, I feel like I should be careful in drawing conclusions that aren't really, really very clear. So, but it appears to me that probably most of these will be 2 doses because that's how you're getting this really awesome efficacy.
Okay, great. Thank you. So another question related to that has been, um, and I think that there's, if I'm reading correctly and remembering correctly, there's a bit of difference in this answer between the Pfizer, BioNTech, and the Moderna. So after you've been vaccinated, after the 7 days after your second dose, are you like not going to get COVID, or is it just that you won't get a serious case of COVID?
Oh, sure. So what they studied, you're talking about after that, once you
Yeah.
have that
Are you
confirmed
immune from
immunity.
contracting it at all? Or could you contract it and be asymptomatic and able to spread it? Or is it you could contract it, have some mild symptoms, and then get over it?
Sure. So it's the 7 days when after 7 days after your second dose of the Pfizer vaccine is when they confirmed immunity for that one. 95% efficacy means for that study, they looked for symptomatic infections or severe illness. So that's was specifically what they were looking at. That 95%. That's what that's referring to, is that 7 days and beyond after that second dose. You had 95% protection against symptomatic illness and severe illness, and so which is really impressive. But you're right, that doesn't talk about asymptomatic carriers, or meaning, sorry, folks who could have the virus and you just don't have symptoms. And then with Moderna, it's just that 14 days after your second dose. And so both of those looked at symptomatic infections. And I think that's probably a really great segue into a lot of folks asking about
Yes.
Masking and other mitigation strategies, and like, why wouldn't the vaccine just replace all of our other mitigation strategies? And it's because we don't yet know about the asymptomatic carriers. So folks who could potentially have the virus and still spread it. And so we just don't know one way or another yet if the vaccine will prevent that. And so it's really important, like we talked about before, it's multiple layers that really protect ourselves and our community. And so that's masking, that's the physical distancing, that's the vaccine now. Getting a vaccination now is a huge thing you can do to protect yourself and the folks that you're around. But it's not just going to replace everything else. I think that's kind of, those go hand in hand. That I feel like those answers.
Yeah. So after you've been vaccinated, it's even more so, we keep saying you wear a mask to protect other people. So after you've been vaccinated, that's really, really true, right? Because you might not be at risk at that point for symptomatic illness or, severe illness, but you could still pass it on to other people. So that mask will protect other people from that. Yes.
Yeah,
Who have not been
we're just not
vaccinated.
sure. And there is, I feel like since the last time we talked about masking in like video format, there is definitely evidence that the mask protects the wearer as well as the people around you, too. So that's an important thing. Multi-layered mask, by the way.
What's that? Multi-layered mask.
Multi-layered, yes. Your mask
3 layers.
One layer to it. Yeah.
Absolutely. Okay. So there's a lot of questions about, should I get the vaccine if? Okay. So one big question is, should I get the vaccine if I've already had COVID-19?
Yes, you should. And when I say should, I mean for your own health and for the folks around you. But absolutely. So we do not know how long someone's immunity might last, who has natural immunity, who has gotten the infection, has survived the infection, and now has antibodies. We don't know how long that protection would last for you. And so we do recommend the vaccine for these individuals. We just recommend waiting until after you're out of your isolation period if you have the infection. And if you've been exposed, we would like you to wait until after your quarantine period. We also would prefer to not unnecessarily expose those healthcare workers who are administering the vaccine.
Okay. So not because of the infection or anything, but just because you don't want to expose other people to the infection. Okay. That makes a lot of sense. So you don't have to like wait a certain amount of time past, that, but just make sure that you are no longer infectious or possibly infectious.
Yep, absolutely.
Okay.
Yep, you can get the vaccine as soon as you're released from isolation. And if it was an exposure, not an illness, then as soon as you're released from quarantine.
Great. Okay, so I'm going to get into a little bit more, sort of granular questions here. Um, so if you've had COVID, yes, you should get it. What about if you are pregnant or lactating or breastfeeding?
Really good questions, really good questions. And so I'll give more details, but the take home point here is going to be talking to your provider who knows you the best and having a conversation. So the reason for that is that pregnant and breastfeeding women were not included in the initial studies for the Pfizer or the Moderna vaccines. And so that's why it really needs to be a conversation to be had. I think this is probably a good point to talk a little bit about the technology behind these two vaccines. So they use mRNA that's known as messenger RNA. So that's the basis for both these vaccines. And to be clear, this is a new technology for vaccines that have been approved, but this technology itself is not new. So there's like the first article published, I think was like 1976, but since the 1970s, they've been researching and looking at how the use of this technology, the mRNA, that messenger RNA, can be used in vaccines. And this really explains how this vaccine was developed so fast, right? So one, it's decades of looking at a technology and how it can be used for vaccines. So then once the genetic sequence was released at the beginning of the pandemic, then scientists had this jumping off point of being able to develop and even test these vaccines in just over 10 months. And so that really the technology explains why this can happen so quickly, which is also super exciting for other illnesses that we need better treatments or vaccines for. And so this is just a synthetic version of messenger RNA, which is just a molecule it's part of a process that makes up proteins in our cells. So this does not change or affect your DNA, which is in the nucleus of your cells. I think that's a very real question for a lot of folks. And so this does not enter the nucleus of your cells, so it does not affect someone's DNA. But what the messenger RNA does is it's like the code, like the recipe for the spike protein of this virus that everyone knows what it looks like because it's everywhere. That's like why it looks so recognizable. And so it helps your body be able to then detect and fight off the virus whenever you're exposed. So it's really amazing. And it's amazing in not a scary way, in my opinion. So this is something that, again, has been researched for many, many years, actually many decades now. It's just the first time it's being used as a vaccine. So I felt like that basis is necessary to explain kind of why we think it's probably safe for breastfeeding and pregnant women, even though they weren't included in the studies. And so we will at some point have data that we can say the vaccine was directly studied in these populations. But for now, what the experts, the scientists in this area who know the most about this mRNA technology, they say based on how this works and because it doesn't go into that nucleus, it doesn't interact with your genetic material, your DNA, it's very unlikely to pose a risk to a fetus or to a pregnant woman, and also very unlikely to cause any problems for someone who is lactating. And so based on what we know currently, it's very unlikely to pose a risk. But also, we know that that these vaccines have not been directly studied in these populations. And so that's why it's just a really important conversation for you to have with your provider who knows you best and be able to make a decision for you if you're in one of those two populations.
Great, thank you. Yeah, that does cover a lot there. So another question that people had that comes up a lot is, what if you are immunocompromised or have some kind of autoimmune disorder? Should you get the vaccine in that case?
That's a really good question. I've talked a lot with my patients who are in those particular populations or groups about this because vaccines raise a lot of questions for them. These populations were included in those studies, and this really comes back to weighing your risk of a vaccine versus the risk of infection. So all of these conditions so far that folks have asked about are also conditions that would increase your risk of a serious illness if you get infected. And so I would say these are folks who would really benefit from getting the vaccine. We've not seen an increase in side effects or in adverse reactions for these particular groups. But we certainly know that chronic illnesses can be risk factors, and a lot are known to be risk factors. for getting seriously ill if you get infected. And so I really think this comes back to what's the whole point of this vaccine. It's all about weighing risks and benefits. Risk versus benefits of the vaccine, risk versus benefits of getting infected with something that is very widespread, at least in our community.
Mhm. Okay, thank you. I meant to ask this after the pregnant and breastfeeding women one, so I'll just backtrack for a second. What about women who are trying to conceive? Is there any reason that they should not get vaccinated when they can get
There
vaccinated?
is not any reason to not get vaccinated, and I would say it would be really great to get vaccinated before you have potentially another a risk factor of being pregnant or being in this in that zone we just talked about where you're having a personalized conversation with your provider, kind of figuring out what's right for you, where we think it's safe. But folks that were prior to pregnancy were included in the vaccine studies. So while you're in a category that is included in that phase 3 trial, go ahead and get it would be my advice to those individuals.
Because it will not at all impact your ability to conceive, right?
Correct.
Okay,
Correct.
that's what I have seen. Okay, so what about people with heart conditions or diabetes or cancer who are, undergoing treatment for that, taking medication, chemotherapy, radiation, different things like that? Are there any groups of people that you would say do not get this vaccine? The risks outweigh the benefits?
No.
Okay.
And it's just really it's that simple. These are all individuals who are at higher risk of serious illness of this virus. So this is real. Folks are getting really sick. Folks are really dying from this virus. And so I would absolutely get the vaccine whenever I was able to do so.
So we talked about why you need to keep wearing a mask and social distancing even after you've had the vaccine. But somebody asked, if I've received both doses of the vaccine, but I'm then exposed and considered a close contact, do I still have to quarantine?
You know what? That is a great question. And I have not seen anything published yet by the CDC. So can we plan to post something for folks to answer that question? And I'll even make myself a note to look into it. So few folks have had the opportunity so far to get vaccinated that this hasn't come up. So thank you for that really awesome question. So we can be proactive here and get you an answer. I don't have an answer right now. So thanks for the question, and we'll get back to you all via probably social media.
Yeah, it's nice to know what we don't have answers for, as long as what we do have
Yes,
answers for.
absolutely.
Okay, so we've asked sort of all the questions that are coming up a lot these days. Is there anything else that you'd like to talk to people about? Is there anything else that you'd like us to be thinking about and know about as we sort of as vaccination starts across the country?
Yeah, so I would just say I personally am really excited to have the opportunity to get this vaccine. I think I'll probably get an opportunity to get it next week, and I'll be getting it as soon as I can. Both selfishly to protect myself, and I'm a wife and a mom, and I want to be there for these people in my life. So selfishly, I want to get it to protect myself. But as importantly, I will get this vaccine as soon as I possibly can to protect people around me. Because for me, I think what would be worse than getting sick from COVID would be to inadvertently spreading it to someone and them getting sick or dying. And so that's why I wear a mask. That's why I physically distance. And that's why I'll get the vaccine, is that's the best thing I can do for the people I care about right now.
Okay, great. Well, thank you so much, Dr. Millum.
Thank you.
Thanks for joining us.
Thanks for having me.